Good morning, Mr. Chair and Senators. Thank you, Michael Emmanuel Rayner, a person living with HIV/AIDS, a client of the AIDS Drug Assistance Program. And first, I want to thank this body. When I came to you on January 14th, Mr. Chair, you allowed me to speak quite a bit to bring an issue that blindsided the legislature from the Health Department. I want to thank the Senators for hearing and acting on the HIV community's concerns with the Florida AIDS Drug Assistance Program and the shortfall that was a surprise that I brought you on January 14th. Your action to propose a solution has given my community significant hope. You have heard our plea, and you have helped and brought action. However, half of the 32,000 clients in the AIDS Drug Assistance Program statewide who are being terminated are fearful and not sure how they're going to survive without access to life-saving HIV medications. These individuals will need to visit emergency rooms and create a financial burden on local hospitals, and all this could be prevented with a far less financial cost to the state and local hospitals. The solution that you're bringing provides for bridge funding identified by the Florida Department of Health to patch DOH's identified shortfall, continuation of the Premium Assistance Program, and protecting eligibility at 400% of the federal poverty limit, which is the goal which we have been striving for. The Senate proposal, though, is being undermined, sabotaged, and kneecapped by the Florida Department of Health at this time. The Department of Health has not halted its changes that are set for March 1. While they are moving forward with the administrative rulemaking process, we understand they're supposed to halt any changes until after that period, which would be sometime in March or perhaps late March. Additionally, they're also not giving the legislature the respect to actually address this through a budgetary solution in which you all are leaning in. Both the Senate and the House have been acting in great faith to the community to really listen and be a partner in this solution. And we are also grateful. But the problem is, by the time this gets to the governor's desk and signed sometime in June, health policies will begin to cancel for non-payment of premium because they have told their contracted processor not to pay premiums for the month of March. So we're going to be having clients go without health insurance, unable to access their doctors, unable to access their life-saving medications, and we're really struggling and fearful of that. We're 10 days away from that time bomb that the Health Department's launching on us. And we really need to implore that this committee, the Senate, the House, work with the governor's office and the Health Department to have them halt these changes immediately. They are not communicating with the HIV community, which has us in deep fear. You know, we even have one individual who I spoke with last night who has already written her obituary. You know, we have Tori Samwell, who is here in the audience that was sitting next to me. She lives in the President's district in Ocala and was featured in the Washington Post and is a mother of children, married, and she makes $3,000 too much and is being booted from the program. Her life depends on it to get access to Biktarvy. You know, I need to remind you that a fair number of individuals with HIV have many co-occurring conditions, whether it's substance abuse, domestic violence, and other types of trauma and homelessness. And this is concerning. And the reason it's concerning is because as people begin to become fearful and desperate, we're really worried about whether or not these individuals will revert back, unfortunately, to maybe using again or end up homeless again in a panic of trying to figure out how to balance their bills. The Health Department is not there engaged in real public health and solving these problems, and we need to hear from them today. You know, DOH needs to stand down. They need to delay the proposed changes until the conclusion of the administrative rulemaking process. And more importantly, the Florida legislature, they need to allow them the time to send a budget to the governor so that it can be approved. I can implore that this body has done its work. You have heard the community. You have stepped up to the challenge. And I could only thank you, because what you are doing by making sure that there are adequate funds to continue access to HIV medications, you are also taking a great step in preventing new cases of HIV by ensuring that treatment is prevention, by suppressing someone's HIV viral load. so that we don't transmit the virus. And I just want to thank you for your time. And I know, Mr. Chair, you have really leaned in along with Chair Trumbull and others, and I just, I'm in a great debt of gratitude, and I just can't wait to go home back to Fort Lauderdale. This driving up and back with my dog each week is killing me. But I really want to thank you because you have heard us.
Thank you, Mr. Rajner.
Mr. Chair.
And I can assure you that we are continuing to have discussions with the Department of Health to address the issue.
Thank you.
Mr. Chair, I do have a question very briefly, Mr. Chair.
You're recognized.
Thank you, Mr. Chair. Thank you, Mr. Rajner. I'm trying to understand what you're saying right now, which is it sounds like we're, this is a race of time. The Florida Senate, as you mentioned, has put forward a very strong language to provide bridge funding for the ADAP program to keep people living with HIV on their medications. But you're saying that because the DOH has put forward these cuts that will begin to take effect, well, actually now, depending on what category of patient, what program you had, some of it's through the end of February, some of it's through the end of March. Are you saying that even in the case that we were able to adopt the Senate language that is provided here to try to temporarily solve the problem, you're saying before we sine die, people are having their benefits defunded by DOH, and they are going off their meds now because they are so expensive, and that this is going to cause major health challenges, potentially worse, even as we go up to sine die. Is that what you're saying? And if that is what you're saying, what is it that we need to do to try to stop that lapse? Because we're trying to provide the funding, but what else needs to be done? I've never seen anything like this. I'm trying to understand as well what the ask is.
Briefly.
Through the chair. Yeah, there are some people who are right now stockpiling their medications and skipping days of medications at a time to have a supply to try to carry out. But to answer the other question, which is the more pressing thing with the time bomb that the Department of Health has laid on us, they have a contracted provider that pays the healthcare premiums, and failure to pay your healthcare premium will result in a notice of termination of your insurance for non-payment of premium. And so, you know, if the health department has told the vendor in February not to pay March's premiums, I don't know which health insurance company out of the goodness of their heart will still covering somebody until maybe July when the budget gets approved and then monies can be backfilled. So I don't know how logistically that gets done, but I just would hate to see all the tremendous work that this Senate has done and that the work that the House is doing. I would hate to see all of that have the rug pulled under the legislature by the health department, where then there may not be insurance policies to pay.
Thank you, Mr. Rajner, for being
Thank you, Mr. Chair.
Mr. Vice Chair.